Welcome. In this session, we are diving into a specialty that doesn't just treat disease, it helps people live again. This is Physical Medicine and Rehabilitation or PM&R. I'm Dr. Jeena and I'll show you how this field bridges medicine and meaningful recovery. The definition goes like this. It's a branch of medicine aims to enhance and restore functional ability and quality of life to people with physical impairments and disabilities. And here the medicine meets the function and quality of life. The person who does this is physiatrist. The branch is called Physiatry. Let's see some history. During first half of 20th century at 1938, Dr. Frank H. Gruson coined the term physiatry and practiced. Rehabilitation term coined by Dr. Howard A. Rusk and later Dr. Bernard Baruch defined the specialty as a combination. Rehabilitation is a team-based. The physiatrist is the medical leader. But the real magic happens when everybody does their part. Other important persons are occupational therapist, physician, rehabilitation tech practitioner, rehabilitation technology support, rehabilitation engineer, vocational rehabilitation counselor, and of course family members. Let's see the aim and goals of PM&R. The aim is to rehabilitate the person. For example, physical therapy, coordinate cognitive rehab, teach use of assistive devices, manage pain, and tailor prosthetics so that the social barriers can be removed, and finally makes the person to actively participate in social activities. And the goals include primarily diagnosis, then comes to treatment, after that rehabilitation, and at the end prevent further complications. Some of the conditions where physiatrists treat are stroke, spinal cord injury, traumatic brain injury, cerebral palsy, amputations, chronic back pain, joint injuries. Physiatrists in hospital generally treats patients who had amputations, spinal cord injury, strokes, traumatic brain injury and others. Whereas in outpatient settings, muscle and joint injury and non-healing ulcers are generally treated. And they are trained to perform various diagnostic techniques like nerve conduction study, electromyography and also treatments like injections to joints and muscle as a pain management. Now, what are the criteria for patient selection? Firstly, a stable clinical status with no emergency situation. Also, patient should have significant persisting deficiency. And finally, the patient must have sufficient cognitive function to learn. The diagnosis is based on certain diagnostic criteria like CT, MRI, X-ray, bone scan, CAT scan, EMG, NCS, nerve conduction study. Coming to the important part, treatment, it can be medical and rehabilitation program. Medical include analgesic, muscle relaxants, NSAID. Rehabilitation programs are physical therapy, occupational therapy, mental health, vocational rehabilitation. The major goal of PM&R is to help the person to function optimally within the limitation. The aim is not fully restoration but to optimize the quality of life. Physiatrists must have medical and practical knowledge which involves which type of wheelchair best suits the patient, what type of prosthetic would fit best, does current house layout accommodate their handicap well. Let's think of a case. Mr. R, 55 years, had a stroke. He couldn't walk, feed himself, or talk clearly. After 4 weeks in rehab with multidisciplinary team, he now walks with a cane, feed himself, and communicate with his family. Physiatrists didn't cure the stroke, but they rebuilt his life. Instead of surgery or broad spectrum drugs, our tools include mobility aids like walkers and wheelchairs, nerve tests like EMG and NCS, targeted injections like Botox for spasticity, orthotics, prosthetics, and functional assessments. Thank you for watching. If you found this video helpful, don't forget to subscribe for more health related content. Stay healthy and see you in the next video.